More and more research shows just how important it is for overall health to get enough sun exposure. One reason being because the sun provides us with vitamin D. It's important because vitamin D benefits the body in so many ways. Research indicates that the so-called sunshine vitamin impacts not only your bones and your skeletal structure, but also immune function, blood pressure, mood, brain function, and your body's overall ability to protect against a range of illnesses. According to a 2019 review, benefits of vitamin D are thought to include support for bone health and immunity, as well as resistance against chronic conditions like heart disease, cancer, diabetes, and depression, and also fighting infections and viruses. Given all of those vitamin D benefits, it's unfortunate that so many people, around 40 to 80%, depending on the race, for example, are lacking in vitamin D. It's estimated that up to 95% of most people's vitamin D comes from casual sunlight exposure. However, because many people today don't spend time in the sun or regularly consume foods that provide enough vitamin D, most adults and children, even infants and breastfeeding babies, are now encouraged to supplement with vitamin D. Vitamin D is also called 25-hydroxyvitamin D, and it's a fat-soluble vitamin that's present only in small amounts in certain foods, and it's made in our bodies only when our skin is exposed to the sun. It's considered an essential micronutrient because the human body can't make it on its own without the assistance of food and sunlight. Calcium and vitamin D are two important micronutrients that work together in the body to support overall health. The complex vitamin D and calcium relationship is especially crucial when it comes to bone metabolism, as both are integral to maintain the strength of the skeleton. Together, they support heart health and a number of other bodily systems. Humans have evolved to spend time outdoors in the sun. The body converts sunshine into chemicals that are then used by the body. In particular, when UVB sunshine rays land on the skin, a substance in the skin called 7-dehydrocholesterol is literally converted into vitamin D3. The 7-dehydrocholesterol, or cholesterol in our skin, is very similar to cholesterol itself, which converts pre-vitamin D and makes it into usable D3, which is sometimes called a provitamin D. Pre-vitamin D first travels through the kidneys and the liver into the bloodstream, and then it's converted into calcitrol. Vitamin D actually becomes a hormone within the body, particularly a secosteroid hormone. There's two types of vitamin D supplements: vitamin D2, ergocalciferol, and vitamin D3, cholecalciferol. The precursor to vitamin D is found in both plant and animal products, but animal-derived products of vitamin D3 are thought to be more absorbable and beneficial. Man-made D vitamin is made in one of two ways. D2 is created by irradiating yeast and other molds, or by irradiating animal oils and cholesterol, creating vitamin D3. The type that our body naturally makes is called cholecalciferol, which is vitamin D3. The body is able to convert some D2 to be used for bodily functions, but it prefers and is able to use D3 much more effectively. Unfortunately, most vitamin D fortified food and dietary supplements mostly contain ergocalciferol, a type of D2, which is neither as absorbable nor convertible by the body into what it needs. D3 from animal products, specifically from the cholesterol, is the closest to what sunlight naturally produces in humans when the skin works to convert UV light. Vitamin D3 is therefore the most active form and thought to be converted up to 500 times faster than D2. D3 has also been estimated to be 4 times more effective in humans. Vitamin D plays a role in calcium absorption in the bones. Calcitrol, converted D vitamin, works with parathyroid hormone to maintain calcium levels. Additionally, it has an effect on other important vitamins and minerals that contribute to both health, including magnesium, vitamin K, and phosphorus. Vitamin D is particularly responsible for maintaining phosphorus levels in the blood, and since it affects calcium's ability to bind to proteins, it's believed that it's also linked to vitamin K. Low levels can result in the softening of your bones, which is called osteomalacia, or a bone abnormality called rickets. Additionally, a deficiency increases your risks for developing osteoporosis and experiencing fractures or broken bones. Studies have shown that vitamin D benefits bone health when taken in doses of 800 to 5,000 international units per day, which can improve musculoskeletal health by naturally slowing the aging of the skeletal structure and reducing the rate of fractures and falls in older adults that are over 65. Older adults with adequate vitamin D levels are more likely to be active, have improved muscle strength, and are less prone to falls and injuries. When levels are low, the parathyroid hormone becomes overactive. This is known as hyperparathyroidism, and it results in a drop in phosphorus. Phosphorus, in addition to calcium and other compounds, are needed in order to properly mineralize bone density. Exposure to UV light causes changes inside the human body, including an increase in vitamin D levels. Our immune cells contain receptors for vitamin D, and it's been shown vitamin D benefits overall immune function in several ways, including by preventing prolonged or excessive inflammatory responses. Emerging research shows that vitamin D helps with healthy cell replication, and it may play a role in protecting against the development of autoimmune conditions, infections, viruses, and less serious illnesses like the common cold and the flu. There's evidence that humans need enough vitamin D in order for macrophages, white blood cells, to attack pathogens, to do their job properly. Vitamin D benefits seem capable of helping to strengthen the immune system by decreasing the ability of some viruses to replicate and grow. It's been shown to enhance the expression of an enzyme called ACE2, which is believed to have the ability to protect against acute lung injury. A 2020 study found that average vitamin D levels among residents of 20 different European countries correlated with the incidence of at least one serious acute respiratory infection. Higher D levels among older adults were associated with reduced rates of deadly infections, while low serum concentrations of vitamin D were linked to higher susceptibility. Because it can help control inflammation, it may also benefit those with chronic diseases and autoimmune disorders like multiple sclerosis, rheumatoid arthritis, irritable bowel syndrome, and other digestive disorders, and high blood pressure. Diabetes symptoms result from a lack of insulin or inadequate insulin secretion following increases in insulin resistance. According to research conducted at the London School of Medicine and Dentistry, calcium is necessary for insulin secretion, and vitamin D benefits promote calcium absorption and utilization, therefore contributing to the regulation of insulin secretion. According to a 2015 study published in Current Diabetes Reviews, vitamin D replacement has beneficial effects on all aspects of type 2 diabetes, including the incidence, control, and complications of the disease. There's also mounting evidence linking low vitamin D levels to diabetes. According to research published in Frontiers in Endocrinology, vitamin D plays a role in factors that influence tumor growth, cell differentiation, and apoptosis. Vitamin D deficiency symptoms have been correlated with increased risk for cancer development, especially breast, colon, and prostate cancers. Researchers have found that increased sunlight exposure and circulating levels of vitamin D are associated with the reduced occurrence and the mortality in many types of cancer. Research shows that it can affect the risk of breast, colon, and ovarian cancers, possibly due to its role in the cell life cycle and its ability to block excess estrogen. According to research published in the American Journal of Clinical Nutrition, improving vitamin D and calcium nutritional status substantially reduces the risk of cancer in postmenopausal women. Another 2018 study helped solidify these breast cancer findings as researchers found postmenopausal women with 60 nanograms per milliliter or more of 25-hydroxyvitamin D, the main form of vitamin D in the blood, had 1/5 the risk of breast cancer when compared to those with under 20 nanograms per milliliter. Vitamin D benefits heart health by helping with the maintenance of normal blood pressure and inflammation levels. A growing number of research points to the fact that low vitamin D levels are linked to increased risk for cardiovascular disease, since it's involved in regulating blood pressure, cholesterol levels, and inflammation. Animal studies have shown that the disruption of vitamin D signaling can contribute to hypertension, atherosclerosis, and cardiac hypertrophy. We know that humans who are deficient are more likely to die from coronary heart disease and other heart-related symptoms, according to research from the Vanderbilt University Medical Center. Because it acts like a hormone within our body and it affects brain function, vitamin D deficiency has been linked to an increased risk for mood disorders, including depression, seasonal affective disorder, and severe mood problems experienced during PMS, insomnia, and anxiety. Low levels can also interfere with proper testosterone and estrogen production, leading to imbalances that can result in many unwanted symptoms. Several studies have shown that vitamin D also affects our ability to make decisions, concentrate, and retain information. Research indicates that people with lower levels perform poorly on standardized exams. They may have poor decision-making skills and have difficulty with tasks that require focus and attention. Additionally, some research has shown a correlation between low levels of vitamin D and increased risk for developing schizophrenia and multiple sclerosis. Some of the ways that vitamin D benefits the skin include supporting the immune system, controlling inflammation, and helping aid in skin cell growth, repair, and metabolism. Adequate levels may even help prevent skin aging and also reduce redness, dryness, and other symptoms caused by eczema and psoriasis. Vitamin D deficiency symptoms can include fatigue, osteoporosis or bone fractures, susceptibility to infectious diseases, higher risk for cardiovascular disease and high blood pressure, high risk for certain types of cancer, autoimmune diseases, depression, insomnia, arthritis, higher risk for diabetes, asthma, chronic pain, skin issues like psoriasis, developmental problems in infants and children. Causes of a vitamin D deficiency and risk factors that can make a low status of vitamin D can include a lack of sunlight exposure, frequent use of sunscreens, which reduces your body's ability to make vitamin D, underlying health conditions like obesity, type 2 diabetes, insulin resistance, and hypertension, which seem to increase a person's risk. Having a darker skin, a higher percentage of African Americans, Hispanics, and Asians living in the United States are believed to suffer from vitamin D insufficiency. Being over the age of 70, certain occupations that limit outdoor time, including being a shift worker, healthcare worker, and an indoor worker, being a nursing home resident or hospitalized patient, having celiac disease, chronic diseases or cystic fibrosis that can interfere with the absorption and the processing of vitamin D in the intestines, kidneys, or the liver. Breastfed infants are also at risk of a vitamin D deficiency, which is why supplementing is recommended. A general recommendation is to get about 10 to 15 minutes of direct sunlight every day without wearing sunscreen if you're fair to medium toned. If you've dark skin, you likely need more time in the sun to make enough vitamin D, about 40 minutes per day. Taking a vitamin D supplement can also be helpful for many people, especially in the winter months and for those who can't spend time outside most days. Some foods high in vitamin D are cod liver oil, halibut, carp, mackerel, eel, and wild-caught salmon. Recommendations for children go as high as 35 units per pound of body weight per day, or about 2,500 units per day for children aged 5 to 10. Recommendations for adults, including pregnant women, can go as high as 5,000 international units per day. However, many recommend much higher doses, such as up to 50,000 international units for a few days when you have a cold or a flu. To get the best vitamin D supplement, look for a fermented, food-based source of vitamin D, preferably fermented with a healthy bacteria, such as Lactobacillus bulgaricus. Vitamin D toxicity can potentially develop if someone takes more than 300,000 international units in a 24-hour period, or more than 10,000 international units of vitamin D per day for a few months. Vitamin K2 can help to prevent hypercalcemia, as it helps control where calcium gets deposited by the body. When someone's blood level becomes abnormally high, vitamin D side effects can include symptoms of hypercalcemia or high blood calcium, such as digestive issues like vomiting, nausea, and stomach pain, diarrhea, fatigue, excessive thirst, and frequent urination. Some possible vitamin D drug interactions are with steroids, epilepsy drugs, weight loss medication, corticosteroids, diabetes medicine, blood pressure drugs, seizure medicine, and calcium supplements and antacids. Vitamin D is a fat-soluble vitamin, which we get mostly from exposing our skin to the sun. Vitamin D benefits overall health in many ways, such as by supporting bone metabolism, cardiovascular function, immunity against infections and illnesses, skin health, and cognitive and mental health. Vitamin D deficiency is believed to be very common because many people today don't spend enough time in the sun due to factors like working indoors or wearing sunblock. The best way to maintain normal levels is to expose your skin to sunlight for 10 to 20 minutes per day. You can also safely increase your vitamin D level by eating vitamin D-rich foods such as fish, cod liver oil, eggs, dairy products, liver, and some mushrooms. Supplementing is a good option for many people, especially the elderly, infants, and people who have malabsorption issues, and those who spend most of their time indoors. To obtain the levels of vitamin D for the benefits, adults would need at least 600 to 800 international units per day, or ideally much higher, and children need at least 600 international units. For the best dose, be sure to get a 25-hydroxy vitamin D blood test to assess your levels and then supplement accordingly to correct any deficiency.